Hello, my name is Dr. Cheryl Burdett from Precision Point Diagnostics, and I wanted to share with you a couple of changes and innovations with our Precision Allergy 88. So as you notice, of course, we are looking at multiple ways the immune system can react to foods. Your IgE, IgG4, IgG total, and your complement or C3D response. And we go through all this information very detailed to show you multiple ways that the immune system could be reacting to the same food. And then we give you a less restrictive diet where all the highs are taken out. And then a more restrictive diet that you would use when someone's more inflamed, where both the moderates and the highs are removed as a way to change the diet. But sometimes we will need to drill down even further. And that is the introduction of the immune index. And I'm very proud to introduce this concept. So the immune index looks at all 88 foods and then ranks them 1 to 88, top to bottom, in terms of what you are more reactive to. And so after you've gone through the explanation, letting people know about their IgG reactions or sensitivities and their IgE reactions or allergies, when they feel overwhelmed and when that's a lot of data to take in, this can be a very simple way to present it to them. Now, we've added up the multiple ways you can react, we've calculated it, and here are the foods that you're most reactive to down to least reactive. This has a lot of clinical utility. How about the patient that you're working with that is just reactive to everything, yet they're unfamiliar with dietary changes? They are finding it overwhelming and confusing. One of the things that you could say to them is, look, I want you to just focus on the top 5 right now, just get a feel for that. And then in 2 weeks, when you understand that, then we might think about removing your next level of foods. Or maybe you're working with somebody who is more immune compromised, and that immune compromise, you know that their immune system won't be as reactive, and so everything is suppressed and low, but you could still tease out what is the top for them. Vice versa, someone who's reactive to so many things that there would be nothing left in the diet, you could say, okay, for you, then we're just going to focus on the top 5 or the top 10 or the top 20, whichever that you feel is most clinically appropriate. Then one more tool that we've added that I'm very excited about is we also are now listing if the foods that your patient is reactive to are also high in other compounds. Are they reacting to many foods that are high in oxalates or glutamate or histamine? And this allows you to see more patterns. Let's say all the foods they're reactive to are also high in histamine. You may decide to do an elimination diet, but to also have them be familiar with a low histamine diet. Or maybe they show up more reactive, having higher levels of oxalates, then we would say, okay, read a list of high oxalate foods. We want you to take those out for now as well. So we're looking for other ways and patterns between the foods, breaking these down into different lenses to really help you and your patient understand what they're reactive to, why they're reactive to it, and what their next steps can be. We are very proud of this test, and we feel like it conveys a lot of information. So the immune index that really boils that down into a very simple piece, followed with understanding more compounds about the foods that you're reactive to, I think will be very helpful to you in your clinical practice. Thanks for taking a minute to learn more about it with me. Look forward to working with you and talking to you more.